Good day and welcome. These are definitely unprecedented and challenging times, but we have all heard this statement numerous times over the past few months. Today, we hope to answer many of your questions as it relates not only to medical care, but more specifically to women's breast care. We have a panel of esteemed physicians with us today, including Dr. Lisa Guerra, breast-dedicated surgical oncologist at Breastlink, Newport Beach, California. Dr. Shawndeep Tung, breast surgical oncologist in Orange, California. And Dr. Jason McKellop, breast-dedicated radiologist at Breastlink Women's Imaging Center in Tarzana, California. Hello, everyone.
Hello, Karen.
Our first question today is for Dr. McKellop. Dr. McKellop, there's been a lot of news lately about essential medical imaging. Can you tell our audience what essential medical imaging is versus non-essential medical imaging?
Hi, Karen. Thank you so much for having me, and I'll try to best answer that question, even though it's a difficult one to answer. Reason being, as you pointed out at the outset, we are indeed in unprecedented times. This COVID-19 crisis has thrown us all a curveball, and the medical community is no exception. Within my field, which is specifically breast imaging, we're forced to make a calculation, just like the rest of the population does on a daily basis, of a risk-benefit analysis to continue doing what we traditionally do in light of this COVID-19 crisis, mitigating the risk of infection with things that we do like routine screening, like diagnostic mammograms. I'm in the business of diagnosing breast cancer. That's essentially the main purpose of what I do. Statistically speaking, women develop breast cancer at a given rate, and that's been reproducibly shown throughout time through several well-controlled clinical trials. We know that women will develop breast cancer. We know that imaging these women on a screening basis, having them undergo screening mammograms, will detect breast cancer at an earlier stage, and in so doing, save lives, thousands of lives. If there's any interruption in the screening paradigm, there will be, unfortunately, an uptick in breast cancer related deaths, breast cancer mortality and morbidity. So when we get to this question, or try to answer this question of what's essential imaging, we have to mitigate the risks of COVID-19, the mortality risks and the morbidity of that condition relative to, in my particular case, or in my subspecialty, breast cancer diagnosis. At the outset, as we've seen from images in the media and outside our very doors, we know that patients have been hospitalized in an acute setting, and some unfortunate few suffer very severe consequences of COVID-19. As we learn more about the condition, we know what the risks are to specific individuals, and again, we have to mitigate those risks. So back to the question, what is essential versus non-essential imaging? That question can best be answered by tailoring it or making it more personalized to an individual patient. And there won't be a universal answer to this question, because we try to do this on a daily basis, triaging patients based on their risk factors for developing the disease. So in the diagnostic setting, if a patient has a palpable lump, if she has a strong family history or a genetic predisposition for developing the disease, we know that we have to increase or raise that patient on a priority status in terms of getting her imaging done, because she stands at an increased risk of developing the disease. If someone has just recently had a routine mammogram within the past couple months, then they're lower on the priority if they don't have a high risk of developing the disease. So we try to risk stratify on a case-by-case basis, try to personalize it as much as possible. And unfortunately, the answer to your question is more of a continuum as opposed to a black and white. We prioritize patients who are at higher risk or whose clinical presentation or of greater concern. And relative to those patients, we reduce the prioritization of those patients that are at lower risk.
Thank you very much, Dr. McKellop. Very informative. Dr. Guerra, during this time, you continue to see patients at Breastlink. Can you talk to the audience a little bit about the importance of continuing medical care as related to breast care and what your recommendations are as well?
Well, and certainly, as Dr. McKellop alluded to, things are continuously changing as more information is becoming available to us, especially with regard to the COVID-19 pandemic. And so a lot of our concerns initially stemmed from, are we going to have enough resources to be able to provide care for our patients? Not only from a breast cancer standpoint, but really looking at individuals that might be directly impacted by COVID-19. Are we going to have enough personal protective equipment? Do we have enough ventilator support? Have the staff that's healthy enough to be able to be taking care of our patients? And so we are very fortunate within Southern California to not be seeing the same sort of situation that unfortunately has been seen in places like New York. So we have been given guidance through organizations like the American Society of Breast Surgeons, like the Society of Surgical Oncology, that really asked our clinicians to see what resources were available locally to help guide us with what our local care would be able to be, essentially, and to be able to provide a prioritization list for individuals that really needed to make it to the operating room, and those that we might be able to potentially change around the order of care so that they were still provided with care, but at the same token, still protecting some of those resources in the event that they might be more limited. Now, we are very fortunate that at this point in time, more and more of the surgical facilities are even opening up their operating rooms to allow for cases that aren't as urgent as cancer care cases. So we're in, again, a very fortunate situation where our cancer patients really are being advised they can go to the operating room. We are taking some special precautions now that we didn't take previously. So different surgical facilities may make recommendations about doing COVID-19 testing at a certain time frame in advance of their surgery, perhaps 72 hours, 4 days or so before surgery, so that we can provide them with their results before we go to the operating room. And that allows us to counsel patients appropriately. If we know that someone has COVID-19, they have the coronavirus, but they are asymptomatic, well, those are individuals that really should have their surgery postponed. They should, because there have been studies that have come out from other countries indicating that 100% of those patients, unfortunately, will develop pneumonia. 45% may require an intensive care unit stay, and unfortunately, 20% of those individuals may die because of coronavirus. So whereas previously, I think surgeons had some concerns about whether we should or should not be taking patients to the operating room, now we have more of those testing resources so that we can counsel patients appropriately. The vast majority of patients, really, we expect to test negative. And so for those individuals, it helps us to feel more confident that those individuals have a much better opportunity to go through their surgery without difficulties or challenges in that post-operative period. Certainly along the lines of having that early diagnosis, we know that timely treatment of breast cancer becomes extremely important. And so I think that we're in such better shape now than we had been to really offer patients that confidence in saying that we're going to be able to take them in not only a timely fashion, but also a safe fashion.
Thank you, Dr. Guerra. Thank you for that. Dr. Tung, you have many patients now who are calling. Some of them are concerned as to whether they should come into the office or they can talk to you via telephone. Can you tell us how are you addressing some of these questions during this challenging time as well?
Good afternoon, Karen. Good afternoon, everyone else on the panel. Thank you for the question. It is a very challenging time that we're dealing with. We as providers here at the centers, seeing patients, exposing ourselves to patients, have concerns just as much as those patients who are coming into our centers concerned about their safety. So we have been really expanding our offerings in regards to telemedicine or telehealth through virtual visits. And what that means is, as you mentioned, people can simply pick up the phone and consult with us through that means, or even being able to just activate the camera on their phone. We all have pretty high definition cameras in our pockets, in our phones nowadays. Many of us have cameras on our screens of our laptops. So being able to provide an opportunity for patients to still be able to connect with their provider, and at the same time be able to mitigate their risk of actually being in contact with their provider, or anyone that they potentially could come in contact with from leaving their home to getting to our office. So that's something that I'm really excited about, that we're ramping up. And the telephone part of it is nothing really new, but living in a digital age, being able to incorporate video conferencing as we are now is very big. Patients, being able to speak to them on the phone is one thing, but being able to speak to them face to face with not just a reassuring voice, but a reassuring expression, I think is huge. And for a lot of our patients, and I think Dr. Guerra would probably agree, a lot of what we discuss with the patient can be discussed over the phone or through a virtual visit. And for those patients that it's appropriate, we could potentially even order additional diagnostic imaging or other studies that we think may be necessary for us to kind of further their care or the diagnostic workup, even prior to ever doing a physical exam. So, there are several instances where we'll see a patient and maybe they need some more imaging or they need another biopsy. Yeah, I'll do the exam at that time. And in a good number of patients, I may not even feel anything. Yet the patient has come to the office, they have that exposure. So to be able to provide them an opportunity where we can limit that exposure to coming to the office is really great. And, invariably there are patients who are going to require that physical visit. And we are taking appropriate measures here in the office and at all Breastlink and RadNet facilities to mitigate that risk. And I think it's very good that what we're doing here in regards to risk mitigation. And I think for the most part, patients are safe. However, there are going to be patients who just don't want to leave the home, and this provides a good opportunity for them to be able to reach out to us and ask questions, get more knowledgeable about their disease, and then figure out what next steps are. And that's kind of what we're doing now. But something that I've thought about in regards to this move to telehealth during this pandemic are those patients who are in remote areas, rural areas, who otherwise don't have access to specialists. They may have to drive an hour or 2 hours or whatever it may be. This can provide them an opportunity to meet with their provider, to discuss their diagnosis, to get some more information, to be able to make a decision. Hey, is this even a provider I want to go see? Or yes, this is a great provider. I feel so relieved to have all this information, and now I can move to next steps. And in those situations for patients who maybe don't have a specialist close by, but there may be a RadNet facility close by or some other facility close by where we can move forward with that workup without them having to leave too far from home. I think that's a kind of an area that's maybe untapped a little bit and is going to be able to provide specialist care to people in remote areas that may not have that access and are really deferring to either their primary care physician who may be practicing kind of out of their scope a little bit, or relying on what they read on Google. And we all know, although the internet is great for knowledge, if you don't know what you're looking for or what you're looking at, you quickly can become very concerned and very stressed over something that may not even really apply to you. So I think it's a wonderful situation that we are in regards to telehealth. And from what I'm gathering from a lot of these video conferencing companies is they're really making leaps and bounds in regards to the security protocols, because there's always that concern for HIPAA compliance and patient health information. We want to keep all that information secure. You don't want to be doing a telehealth visit with the patient and someone hack in and kind of hijack that. So it's reassuring to hear that these companies are taking this very seriously. And, you know, with every situation that brings adversity, you know, we find innovation. And you know, it's tough to kind of even mention finding the light at the end of the tunnel with this pandemic. But again, I reiterate, anytime we as Americans face adversity, we always come out on the other end stronger, smarter, more innovative, and ready to take on the next challenge. And I feel that here at Breastlink, we're really taking advantage of technology to be able to provide our patients continued counseling and another option for them to be able to reach out to us without having to worry about maybe increasing their risk for COVID-19 exposure.
And that's definitely an option that is available to women. So that's great. Dr. McKellop, what advice would you give a woman who has a screening mammogram on schedule? What would your advice be to her today?
So I'd like to piggyback off of Dr. Tung's last comment with the incorporation of technology. Here in our screening and diagnostic imaging setup, we've tried to incorporate as best we can technology to further mitigate the risk of, you know, COVID-19 transmission, and in so doing provide a sense of comfort and safety for patients. One such implementation is a virtual waiting room. So patients have the opportunity now to schedule an appointment and actually wait in the comfort of their cars before coming in to be seen by a practitioner. I know there's a concern by patients, you know, not only contact with the general population, but contact with general practitioners. So implementation of some of these technological features like the virtual waiting room should provide them with some comfort that they're going to be minimizing any contact with the general population or with technologist staff or physicians. As far as in regards to your question, I would say that if it is time for a woman to have imaging, she should feel a sense of comfort. We've all sworn an oath, the Hippocratic Oath, upon graduating medical school, which is to first do no harm. And we're guided by this principle in our day-to-day activity as physicians. And same so when we consider our current circumstance with the COVID-19 crisis, do we put patients at risk of disease transmission with coronavirus by putting them into our imaging facility? And we've tried our best from the very start to mitigate that risk by making one basic assumption that everyone has the virus. If it's a case that there are asymptomatic carriers out there, we have to assume basically everyone has it. And we've implemented protocols at our facility that are based on that presumption that anyone, even asymptomatic people, can be carrying it. So when a woman steps into our facility, she'll notice that you know, our doors to the waiting room are open. She won't have to contact the door handles, which is another fomite or inanimate object that you could transmit the disease. If she plans to wait in the waiting room versus waiting in her car, we've cut down on the use of paper. So filling out the paper surveys, which we're doing a mere 2 months ago, that's all done electronically currently. We try to keep spaces as open as possible. We had spacious waiting rooms that previously allowed for good distancing between patients, but certainly still maintain an adequate spacing within our waiting rooms and within our sub-waiting rooms. So that being said, I would say that if a woman requires imaging at this point, that she should feel comfortable in this environment, certainly more comfortable than she would otherwise at a local supermarket, for instance, and that she'd be in safe hands here at Breastlink.
Thank you very much. Are there any last words that you would like to tell our viewer audience?
The only thing I'd like to add, really kind of in line with everything that we've been discussing, this is a tough time for everybody. We're all in this together. We are all learning about what is most appropriate together as well. None of us really know exactly what the right thing to do is. And as Dr. Guerra kind of touched upon earlier, we have people in all walks of life who are trying to figure out what are best practices, what are the best things that we can do. And in our own societies, we have that guidance, we have that leadership, and we have that ability to be able to reach out to our mentors on a national level and bring that down to our patients and be able to treat them as our colleagues are throughout the country. And as Dr. Guerra mentioned, at the same time, kind of fine tune to exactly what we're dealing with here. And I think we're all well aware of the fact that California was anticipated to take a big hit. And, you know, for whatever reason, we didn't. And I think that although we perhaps got lucky, or, you know, it's a function of our mitigation efforts, the point is that we aren't just ignoring all these all this guidance and all these recommendations from our mentors or the healthcare professionals who are helping us learn how to mitigate and to be able to kind of tamp down this problem. And we are taking those steps for our patients to make sure that for the people that do need to come in or that do want to come in or refusing virtual visits, that we're doing everything that we can to make sure that it's a safe experience, not only for them, but for all the staff that's here to take care of them, right? We worry about our staff as much as we worry about the patients. So it's really important that the patients know that if they do find the need, or we say that you do need to come in, that they're going to be safe.
And I think that speaking to that point, we have really maintained the philosophy that if a patient has a concern and they want to be seen, they can be seen. So if something is of concern to an individual, we are here for you. You are more than welcome to come in for those visits, seek the care that you need, and in a safe environment.
Thank you very much. Thank you to our esteemed panel of physicians, Dr. Guerra, Dr. Tung, Dr. McKellop. Thank you for your time today. Thank you for your comments. We look forward to reconvening for our next session. And anyone who has any questions, please feel free to contact us at the information set below. Thank you and have a great day. Be safe.